Since 1995, Incheon St. Mary's Hospital of Catholic University has strived to achieve local health improvement with advanced medical technology based on the love of Christ. Especially a newborn is required careful consideration and observation in order to adjust well. Therefore, we hope that this video may guide you to nurse your newborn baby. Generally, a bath helps to enhance physical and emotional relaxation and improve blood circulation and a good appetite. When bathing the newborn baby, an adequate temperature of room is 22 to 26 degrees Celsius and water is 38 to 40 degrees Celsius, which you find out warm when your elbow is submerged. Avoid bathing a newborn baby immediately after feeding. Give a bath before mealtime instead. A bath before bedtime can also help the newborn falling asleep. Giving a bath once a day at a regular time is ideal, and maintaining warm environment is important. Wrap a towel around the newborn's body except the head to avoid getting cold after taking off the clothes. Close the newborn's ears with the thumb and forefinger to prevent water to go in the ear. Washing the face and then gently wiping each eye from inside to outside corner. Do not use soap while washing a newborn's face. After face done, wash the hair with soap and shampoo, which are only for babies. While the newborn wrapped in a towel, support the neck with one hand and wipe from the arm to the chest and to the tummy. Before you turn a baby front to back, put your hand under baby's armpit and let a baby lean on your arm. In this position, clean the baby's back, hip, legs, and genitals in order. Lift the baby out of the tub, wrap with a big towel, and pat the baby dry, and then finish off with oil or lotion to rub a baby. After dressing up the baby, hold the head and remove water around the outer ear and debris inside the nose gently with cotton. It is important to keep the navel dry. The umbilical cord will fall off by itself within 7 to 14 days. Use alcohol to disinfect the navel 2 to 3 times a day after a bath. After patting the navel dry, disinfect the cord with alcohol and clean cotton, and then wipe around it in circle from inside the navel to 5 centimeters out. It is advisable to expose the belly button to the air by keeping the diaper below it. Once the umbilical cord completely falls off, disinfect inside the belly button until the cord stump is healed. Until 3 days after the cord falls off, give a partial bath and disinfect it continually. If there is any discharge or pus from the belly button, the skin looks reddish and smells bad, or if a tissue grows abnormal, then see a doctor soon. Breast milk is much better than formula milk for a baby. Since breast milk is the best nutrition, it keeps babies away from infection or allergy. Breast milk is absorbed completely, so babies grow strong. Breastfeeding is usually done every 3 hours. Whenever a baby is hungry, breastfeeding is carried on for 15 to 30 minutes due to individual difference. Cleansing nipple with water and massaging breast before feeding a baby. After warming the breast with warm towel, massage it gently. When latching a baby for feeding, lay down a baby on mom's arm and support baby's bottom. Hold a baby gently so baby's tummy is faced on mom's tummy. Using the other hand, hold the breast and stimulate baby's lips to open wide. Once a baby opens the mouth, put a nipple up to the areola into the mouth and hold the baby tight towards mom. Once a baby adjusts one breast to be fed, try the other one after burping. If you notice 4 conditions while you are feeding a baby, you will attain soon successful breastfeeding. 1. Breast milk comes out well. 2. Feeling like cramp on the lower tummy while feeding a baby. 3. Sound like swallowing breast milk. 4. Falling asleep straight after feeding. Colostrum is thick and colored in between yellow and orange. It comes only 3 to 4 days after delivery. After colostrum, breast milk is getting lightened gradually and turns to white color. Breast milk contains protein, natrium, antibodies, various immune and less fat and calories. Nutrition in breast milk gets changed naturally according to physical growth. If you want to refrigerate breast milk, you should use a disinfected device. Refrigeration is up to 72 hours and storage in the freezer is safe up to 2 to 3 months. Breast milk is thawed slowly under 55 degrees Celsius and then warmed up to room temperature for feeding. Once you thaw breast milk, do not freeze it again. Read the instructions on the formula package to check the amount of water and the number of scoops needed for each bottle. It is important to measure the formula milk and water accurately. Since hot water could destroy the nutrients in the baby's formula, make sure to cool down to lukewarm before adding the milk powder. When you feed formula milk, carry a baby in an upright position and support the head with your arm. Let a baby open the mouth and lay the teat on the tongue. It is not recommended to feed the baby while lying. Feeding the baby in a lying position increases the risk of choking or suffocating and causes ear infections when milk goes into the middle ear. The baby may vomit if lying down right after feeding because of stomach pressure increased. After burping, it is safe for a baby to lie on the right side for 30 minutes to 1 hour. If the airway is blocked due to vomit, baby's body may turn to blue or pale. In this case, let a baby cry by tapping a sole or back after putting a head down, and then check whether a baby is breathing or not. If not, please run to the emergency room nearby as soon as possible. Visit a doctor when the baby's vomit is shooting out like a fountain, continuous with blood and bile juice when the baby loses weight, or if they are tired or cranky after vomiting. Jaundice is yellowish skin colored due to increased bilirubin level in the blood. The newborn cannot remove the bilirubin quickly enough because of immature liver function. The function that eliminates the bilirubin is weak. Jaundice occurs in 50% to 70% of all newborns. Jaundice usually begins around the second to third day after birth and disappears after 7 to 10 days. For breastfed babies, jaundice is delayed to disappear depending on individual differences. Jaundice usually appears first on the face, then spreads to the chest, tummy, legs, and eyes. If you find jaundice on the tummy, you should see a doctor. Jaundice is noticed if the color of the skin remains yellow when the skin is pressed and then off. Jaundice is treated by phototherapy and an exchange transfusion is required in most severe cases. If phototherapy is missed, it may cause kernicterus, which is a bilirubin-induced brain dysfunction and apparently lead to brain damage. When you measure the baby's temperature, wipe the sweat away and put the thermometer on the armpit tight. If a baby is cranky, temperature may not be accurate. Comfort a baby while measuring a temperature. Please concern that a baby is feverish when the body temperature is more than 37.5 degrees Celsius. When a baby has a fever, you ought to check if the room temperature is too hot or if the baby dressed too much. If the baby is still feverish after dressing the baby light and adjusting the room temperature, you should wipe the baby with a warm wet towel or bathe the baby in the lukewarm water. Visit a doctor if the baby is continually feverish, cranky, vomiting after feeding, or lethargic. Since birth, the baby expels a dark green meconium for 2 to 3 days. From the third day until the second week, stool can be loose and mucus, and the color of stool turns to yellow-brown. Breastfed babies have loose stools compared to milk-fed babies. Stool can be colored greenish due to increased bile juice to eliminate and food intake. It is more frequent to observe the appearance and consistency of stool rather than the frequency or color. While looking after a baby, hand washing is recommended because of germs, which causes diarrhea, come through hands to the stomach. Congenital metabolism dysfunction is attributed to lack of enzymes for absorption of carbohydrates, proteins, fats, etc. Generally, early diagnosis is important, since if not, it affects the brain and causes not only a serious intellectual disorder, but also disorders in the liver, stomach, and kidneys. The early detection leads to special diet and medical treatment, so eventually the possibility of mental disorder is reduced and normal growth following. The basic examination includes 6 types of tests, which are congenital hypothyroidism, 3 types of amino acids metabolism dysfunction, congenital adrenal gland dysfunction, carbohydrate metabolism dysfunction. The government arranges the basic examination as free. There are 43 different types of the test available with additional cost. The test is recommended to conduct 2 to 7 days after delivery, and blood sample is taken from the heel. The result comes in 2 to 3 weeks. Vaccination is to prevent epidemics from resistance enhancement to the body. Mandatory vaccinations are free, but optional vaccinations are available with additional cost. Immunization schedule is followed by child's age. First, hepatitis B immunization is given in 7 days after birth, and then second and third dose follow in order. If the baby is born healthy in Incheon St. Mary's Hospital, hepatitis B vaccine, which named Hepavax, is injected on the left thigh at the day of birth. BCG is usually given in 4 weeks after birth for preventing tuberculosis. All medical staff in Incheon St. Mary's Hospital are looking after newborns with love and care. We hope that all newborns in hospital grow strong and healthy.